My name is Ruth. I'm going to be your nurse today. I'm in student role. I'm going to be providing you with your health assessment. I'm going to go ahead and provide you for some privacy so you can go ahead and take your shirt off. I've left a drape there. If the room's too cool, let me know. I'll go ahead and make adjustments. Is it okay?
No, that's fine. Thank you very much.
Okay, I'll give you your privacy for a moment. Knock, knock.
Come in.
Okay, thank you, sir. I'm going to go ahead and sanitize my hands. Alright, well, we're going to do a head-to-toe assessment today. Have you ever had an assessment done?
No.
Never? Okay. Well, I'm going to be explaining to you step by step what to expect, okay?
Okay.
I will be placing my hands on you, and is that okay? Do I have your permission?
Yes.
I'm going to start with some just basic assessment skills. Can you state your full name for me, please?
Casey Dobbs,
Okay. Can you tell me what town you're in right now?
Hot Springs,
Do you know what year it is?
2016.
And do you know what we're doing right now?
Well, we're doing assessment.
Great. Okay. The patient appears alert, oriented. Speech is clear and spontaneous. He's oriented ×4. Previously, the patient, Mr. Dobbs' vital signs were taken. I'll go ahead and state those now. His blood pressure is 124/76, heart rate of 82, oxygen saturation 98% on room air, and respirations of 16. Okay, now we're going to start with your skin assessment. I'm just going to be looking over your body for any moles or tattoos or scars or any lesions or any open wounds, okay?
Okay.
Just going to be touching your arms and your legs. Skin is warm bilaterally. Skin is moist with coarse hair covering the chest and the arms and the legs. Skin on the back is intact with coarse hair, and skin has freckling sparsely throughout, but it's consistent with skin tone and color. Okay, now we're going to go ahead and we're going to do our facial assessment. I'm going to start with your head. Tell me if you feel any tenderness, or I'm also inspecting the hair follicles. Any tenderness or pain while
No.
okay? Okay. Hair is red in color. It's coarse and clean. It is without parasites, and it's wavy. Okay. Patient has noted facial hair, red in color, consistent with hair color. Eyebrows intact. Eyelashes everted. Eyes are symmetrical in color and in symmetry. Nose is midline to face. Nares appear patent. I'm going to examine your nares for you. Nares are patent without drainage. Noted. If you smile for me, your smile is symmetrical. Can you go for me? Tonsils are without swelling, noted. The throat is pink in color with veins present. Tongue is intact, pink in color. Saliva present, moist. Lips are without cracking or breaking, moist, pink in color, and symmetrical. Okay, now we're going to go ahead and I'm going to use this as an ophthalmoscope today, and just explain how I would use an ophthalmoscope. First, we would test the scope to make sure it was working properly, and then we would prepare the patient to how bright the scope is going to be in their eyes. So when I shine this into your eyes, it might be really bright. And I would darken the room. We're not going to do that for the video purposes today. And so then I'm going to instruct you to look at a spot over on the far wall and just look straight ahead. Don't deviate your eyes, please. Then I'm going to place my hand on your forehead. And then I'm going to come in. I would dial it down to 0 if I had it on the scope. And then I come in, looking for the red reflex. And then we would do that bilaterally. You move in slowly until your forehead touches the right thumb. And then you examine your pupils bilaterally and for the red reflex. Okay, then we would do the same over here. And whichever side you're assessing, use the same side on a hand. If you're assessing the left eye, you use your left hand. If you're assessing the right eye, you use your right hand. Now we're going to use the otoscope to check your ears. So I'm going to be placing this in your ear. So provide for the angle. And you're visualizing the tympanic membrane. Very little circulum and or earwax, a small amount, and the tympanic membrane is intact, gray, shiny, non-bulging. Now we'll do the same for this ear. And this ear is the same as the other. The tympanic membrane is gray, shiny, pearly in color, non-bulging, and very little earwax in that ear canal as well. No redness noted or anything. Okay, next we're going to do our assessment on your nose system. So we're going to start with your pre-auricle nose. I'm just going to be palpating. Let me know if you're feeling tenderness. Your post-auricle. Your occipital. Your jugular, submandibular, subclavicle, your submandibular I've already done, your deep, clavicle chain, your supraclavicle chain, clavicle, and your posterior clavicle. Okay. Lymph nodes are non-inflamed, no lumps noted, no tenderness noted. And bilaterally, there's the same. Okay, eyes. We've already done the eyes and the nose and the, so now we're going to go ahead and we're going to move to your thoracic and lung area. I want you to breathe normally as I auscultate your lungs, please, sir. time I want you to breathe deeply when we get started. Go ahead and pitch this one sounds auscultated, clear bilaterally, upper and lower lobes. Now we're going to do, I'm going to listen to your heart, so just breathe normally, please. First, I'm going to do your carotid artery, and then we're going to move into your heart, okay?
Okay.
And when I do your carotid artery, I'm going to tell you to hold your breath, and if you want to fix it, just hold your breath. No brutes noted bilaterally. I'm just going to say pulse. +2 bilaterally on the carotid artery pulse. Okay. First, we're going to do the aortic. Second, costal space. Phlegmatic. Erb's point. Tricuspid. And the mitral. Now I would like for you to lay down and turn to your left side and listen for murmurs. Okay, just lay back towards the ambulance. And remain laid. S1, S2 noted. No murmurs noted. Carotid arteries are +2 bilat. No brutes noted. Okay, now, sir, we're going to do your abdominal. So just relax down and back. First, I'm going to inspect. The skin is intact. No scars noted from any surgery sites. No piercings noted. Skin is consistent with ethnicity. And red colored hair is coarsely covering the abdominal area. And skin is moist and intact. Now we're going to auscultate times 4 quadrants. have normal vowel sounds times 4 quadrants. Now I'm going to do an assessment palpation. Also, no peristalsis noted or bruise. So let me know if you feel any tenderness, sir.
Okay.
Okay, now I'm going to list the major organs in each quadrant. In your right upper quadrant, we have the duodenum, the liver, the right kidney, the gallbladder, colon, ascending and transverse, and the adrenal. In your left upper quadrant, you have your stomach, your left kidney, your spleen, your colon's transverse and descending, and your pancreas. In your left lower quadrant, you have the descending sigmoid and sigmoid colon, your left ureter, or left spermatic cord. And then the right lower quadrant, you have your sacrum, your right ovary if you're ovary and tube if you're female, or right spermatic cord if you're a male. Okay, sir. Now, if I could get you to stand, please, I'm going to do an assessment of your legs. Okay. There's no varices noted or observed. No edema noted bilaterally in lower extremities. I'm going to go ahead and check capillary refill in my foot. Capillary refill is less than 3 seconds bilaterally, upper and lower extremities. Okay, sir. All right. Do you have any questions for me on your health assessment?
No, thank you very much.
Thank you for your help, and I appreciate meeting you today.